Lavina PARYANI.
Good morning, everyone. I'm privileged to be here to discuss the case beyond the antibodies, a seronegative case of ocular myasthenia gravis. Myasthenia is an autoimmune disorder of neuromuscular junction of skeletal muscles. In the eye, it affects extraocular muscles, levator, palpebrae, and orbicularis oculi. Its incidence ranges from 0.04 to 5 per 1 lakh population, out of which ocular myasthenia accounts for 15 to 20%, and 50% of which will generalize within 2 years. These are the mimickers of ocular myasthenia gravis. Now, in our case, a 33-year-old female had presented with the chief complaint of drooping of both eye upper lids since last 2 years, which started in one eye, was insidious in onset, painless in nature, and increased as the day progressed and aggravated with more stress and more work. With similar aggravating features, patient also had binocular diplopia, more for distance intermittently. History of drug allergy to certain NSAIDs and antibiotics was present, and there was no associated lid swelling, diminution of vision, or change in ptosis with jaw movement, and no associated systemic findings were there. Extraocular movements were full and free. Best corrected visual acuity was 6/6 in both eyes. Color vision was normal. Pupils were normal size, reacting to light, and anterior segment and fundus examination was within normal limits. On performing the ptosis evaluation, the margin reflex distance 1 was 1 millimeters, which after the ice pack test changed to 4 millimeters, suggesting a positive response. Similarly, fatigability test was also positive, where post-test MRD1 was -1 millimeters. So provisional diagnosis of ocular myasthenia was made, and the patient was planned for the following. We had certain differentials in mind, including Lambert-Eaton syndrome, botulism, and cranial nerve palsies, which were ruled out. Patient underwent serological tests where anti-acetylcholine receptor and anti-MuSK antibodies were surprisingly negative. We ruled out associated autoimmune disorders like thyroid function test, RA factor, and ANA, which were also negative. Electromyography study, including nerve conduction and repetitive nerve stimulation, were all negative. HRCT thorax did not show associated thymic enlargement. On high clinical suspicion, patient was labeled as seronegative ocular myasthenia gravis, was referred to neurologist and started on pyridostigmine to reduce symptoms and prednisolone 20 mg to reduce the progression of the disease. Patient had stopped medications abruptly for 6 weeks due to side effects, which led to worsening of symptoms, and the disease started generalizing, after which the patient was asked to restart the previous medications, and tablet azathioprine was added as an immunosuppressant, which led to significant improvement of symptoms. Patient was counseled for periodic follow-up and was asked to avoid certain drugs in myasthenia due to drug interaction. So ice pack test has sensitivity of 77 to 80% and specificity as high as 98 to 100%. Acetylcholine receptor antibodies are positive in 80 to 99% of generalized cases, but in only 30 to 77% of ocular myasthenia cases. In negative cases, we need to look for other antibodies. This is the literature review. And in our case, which was seronegative, we relied on positive ice pack test, and starting the anti-myasthenia treatment and monitoring the response may be considered in such selected cases. So ocular myasthenia is potentially disabling. This timely diagnosis and long-term monitoring for conversion, especially for the first 2 years, is important. And individualized treatment strategy is important in certain situations. Thank you.
Nice presentation, Dr. Lavina.
Thank you.
Could you comment on what are the chances of developing systemic MG in cases that are diagnosed with ocular MG?
Ma'am, most of the studies have showed that 50% cases will generalize within 2 years.
And how long have you followed up this patient?
And we are still under follow-up, like it's been 6 months now, and she's like symptomatically normal.
Okay. And what was the duration of the ice pack test that you did?
Ma'am, 2 minutes, ma'am.
So why didn't you do the neurostigmine test?
Ma'am, like in our institute, it's not done, and it also has like severe side effects. So,
but you're giving all the medications. I mean, just based on the eyes test.
Yes, ma'am.
There has to be some confirmatory.
Yes, agreed, ma'am. But like there were patient also had financial constraints, so we could not do SF-EMG also. So we gave her the trial and started her on treatment, and positive response suggested that we were direct, like we were thinking.
Is the
correct.
patient still on steroids?
Yes, ma'am.
So as per literature, what is the percentage in which we can see the seronegativity, but still it is there, the disease is there? So how much percentage?
Ma'am, like out of all myasthenia, it's like 10 to 20% cases.